Hello, my name is Glennon Berezin. I am the Environmental Public Health Tracking Program Manager and an epidemiologist at the Department of Public Health in the Bureau of Environmental Health. Thank you so much for taking time to watch this webinar, Informing Coalition Work Through Environmental Tracking Data. We're going to try to get through a couple of objectives. So we're going to build awareness of the Environmental Public Health Tracking website, demonstrate how to use environmental public health tracking tools to extract data available on the website, and share how environmental public health tracking resources can be applied to coalition work. So just to give you an outline of an agenda, we're going to start with an overarching view of environmental public health tracking. How can environmental public health tracking work for you? It might not be an area you're necessarily familiar with, but you'll find out that it could easily be applicable to your program. An overview of the website itself and tools, so that will be our demonstration, and then a real-world discussion of EPHT and the future of environmental public health tracking. So like I said, we're going to get started with an overview. So for those of you who may be sort of uncomfortable or not fully aware of what environmental health is, this is a really nice definition. Essentially, it's the art and science of protecting against environmental factors that may adversely impact human health or ecological balances essential to long-term human health and environmental quality. So this can basically be relevant to an individual, but also for long-term public health. So we know environment matters, but it always hasn't been easy to make those connections. And so the Environmental Public Health Tracking Network started when the Pew Environmental Commission in the year 2000 identified in a report to Congress a gap in basic knowledge, basic data, and tools available to identify links between our environment and our health. And so the Environmental Public Health Tracking Network was born. And it is essentially a system that integrates health, exposure, or contaminants, hazard information, all of that data into one place, and makes those data available at various geographic levels. So Massachusetts was one of the first states to join back in 2002, and today there are 25 participating states, including one local municipality. So New York City is the one city that participates as well. So that's a very high level understanding of what environmental health is and what environmental public health tracking is. But how does EPHT help you? You're not doing necessarily environmental health work. Why is this relevant? So for one thing, we have an expanding definition of what environmental health is. So there are many practical applications of environmental health. More and more we're focusing on the social determinants of health, vulnerable populations, our built environment and community design, and things like climate change. So all of these things, all of these factors are coming together that impact how we're exposed to hazards, but also all contribute to those health outcomes at the very end. So all of these factors are very closely interrelated. And as such, there are broad implications or applications of EPHT. So information available on the tracking website can inform things like health impact assessments, community needs assessments, emergency preparedness and planning, climate change adaptation planning, grant proposals, reporting and evaluation, and collaborating with other cities and towns and regions. Because our data is collected consistently across the state, information that you have in one community is the same and comparable to information you have in another city. So if your coalition doesn't necessarily have all of the resources for one particular town, you can use this data and work with other cities and regions to inform any number of projects that I listed above. And as you can see, there's probably a lot more applications. This is just to give you an idea of some of the things that you might work on. So moving right along into what is in the EPHT toolbox for you to use, I'm going to go through these slides very basically, the data and content that we have available on EPHT that might matter to you. So this is a quick list of health outcomes, asthma, birth defects, cancer, etc. And I'll show you where to find all of this on the website, but this can be a reference to you. It's very easy and put into one place. And our environmental hazard data and content is air quality, drinking water quality, climate change, and there are some radon resources. We are working on getting radon data, and there's a lot of other data sets that we're interested in adding on to these. So in addition, I wanted to highlight the fact that we have what we're calling community profiles. And again, I'll show you exactly where to find this on the website, but it is essentially bringing a lot of this data into one place. So if you're interested in a number of topics about your community, this allows you to kind of get a snapshot of multiple health outcomes in one place. It's a really great place to start, and it's also a printable document, so you can share this at meetings, and it synthesizes information and provides comparisons that may not be as easy to use as the query systems, which I'll show you as well. Here's a snapshot of what a community profile looks like, and again, we'll show you what that looks like live. So let's jump right into the demonstration. I'm going to navigate to the website, so apologize for the technical difficulties. Oops. Oh, you know what? That wasn't part of the plan. This is the landing page for the Environmental Public Health Tracking website right now. I will note a little later as a reminder, we will be moving to a mobile design, so this look and feel might change, but all of the topic areas that we discussed today will still be available and will remain consistent. So this is a nice place to start. Each leaf has a menu option that you can navigate to. So we'll start with health data. Any of these leaves will take you to our landing pages. And as you can see, the menu options above mimic those leaves. So that's a great way to be able to navigate back to what you need. So just quickly, if you go to the health or environmental pages, you can see all of the data that's available listed in a table. So our health data, here they are. You can see the type of the health outcome itself, the type of statistics that would be available, and the geography. So if you don't want to take the time to go into our query systems, here you have a kind of a laundry list of what you would be able to find. So I will point out that one of those leaves and one of these menu items is the community profile. If you click that button, it should bring you, oh, I'm sorry, it's thinking. It will bring you to a query page where you can select your community. This takes you right to a report, so it may take a moment to load. All of the data that we have is stored behind the scenes, and it's being dynamically accessed. So that's why sometimes you'll see that spinning circle. It doesn't mean the site isn't working, it just means it's accessing that data on the fly. So here you would just go down to the town of interest and select that town, and you would click next. Then you would come up with a window that would ask you if you wanted in a printable version or an HTML version. The only difference is that the one that says PDF will give you nice succinct pages and be formatted for printing, and that's the only difference. And then you could navigate back to look at another town. For the sake of time, I've already pulled up Lynn, and I'll walk you quickly through what this has in it. It tells you a little bit about, for the unknowing user, what is the community profile. So some FAQs at the beginning. It walks through Lynn's geography, some basic demographics of age, income, and poverty. It has a section on environmental justice, which is a really important colliding of worlds between social determinants of health, important social determinants of health, and environmental health in general. So when folks don't have necessarily the voice or ability to advocate for themselves, we have measures for that. And this comes from the Executive Office of Energy and Environmental Affairs. So all of these things additionally have links. So if you were to visualize this online, you can and want to learn more about something, all of the links will take you to more information. It then moves through Lynn's Health, or whatever community you're looking at, the health section. So we have comparisons for your community to the state in a number of different indicators. Heart attack, asthma, we're looking at male, female, and statewide rates. Great for informing a needs assessment, great for informing a grant application to look at elevated rates compared to the state. It moves through environmental quality, and then we land on climate change, and it talks about a scenario specific to Lynn on climate change. So that's just to give you an idea of the community profile. In addition to that, if we go back to our website, I wanted to give you an opportunity to look at what our dynamic query systems look like. So it may be a little bit intimidating at first, but just know that all of our query systems essentially function the same way. So if you're interested in a topic, you click on that via navigating through the health or environmental section. I've gone to asthma. I'm interested in pediatric asthma in this example. But for any of our content pages, the data is always available on this right-hand side in the Maps and Tables buttons. Again, that might change, that location of that button might change in the mobile-friendly site, but essentially you're just going to want to click for Maps and Tables or Exploring Data, and the report that comes up from that will be related to the content area that you're on. So here we are in asthma. I'm going to click this button, and I'm interested in pediatric prevalence. We also happen to have hospitalization for asthma, but for this example, we're going to look at pediatric prevalence. Our pediatric asthma data is K through 8 children, and it's a school-based reported system. Every data set is a little bit different. And if you look at that content page, you'll get some information about that data set right there in the content page so that you can understand exactly what it is you're looking at. So every query system that comes up is navigated top to bottom and left to right. So you always want to go in that flow, because sometimes you click something and the resulting query will change. So I'm showing you that when I click by school as opposed to by geography, different options might appear. So we don't report pediatric diabetes by school because the numbers are very, very small and it's sensitive data, but asthma is available. So that's just an example. If you get ahead of yourself in the query and then change something further upstream, you might have to redo your query. So that's just always good to go top to bottom, left to right. I am going to select Lynn, again, just for the sake of consistency. I would update those schools. So it's important to just kind of pay attention to some of the details as you walk through these query systems so that you know exactly what you're looking for. The year 2013. And here there's a note, the map wouldn't be available if multiple school years were selected, but because we're just going to look at 2013 to 14 school year, I'll be able to look at a map. As opposed to clicking Submit Now, for the sake of time, I've already run the query. I would click Submit. It would take some time and a map would eventually generate. So here we are in Lynn. This is the default view of the map. So if you were interested in pediatric asthma for any particular reason by school, you have essentially all the schools in Lynn. You know, based on these black, red, and white circles, whether or not they're statistically significantly elevated compared to the state, so all schools for the state. You can see based on this legend's coloration where those rates lie based on how the triangle looks. So let's say I wanted to select this particular school, Breed Middle School. I can click on that feature and it will give me some specific information about that data point. So I know the exact prevalence is 16.6 children per 100 students, and if I wasn't sure exactly what that unit was, I can always look at the top title, Pediatric Asthma Prevalence per 100 students for males and females for that particular school year. So when in doubt, take a look at that title. So one interesting feature of the pediatric prevalence is that you also have the community prevalence behind it. So you know that Lynn overall, the prevalence is 13.5. So not only does this Breed Middle School that we were looking at earlier appear to be higher than the statewide average, because that's usually what we're comparing when we talk about statistical significance, it also appears to be elevated, at least numerically, to the community. So one nice feature about our dynamic map layers is that this feature icon at the top that looks like a bunch of squares on top of one another is our layers. You can actually go ahead and add additional layers to compare. So one interesting feature here that you might be curious, what are the environmental justice groupings in this region? And you add EJ, you see that, in fact, Breed Middle School is lying within an environmental justice block group. If you were curious for the EJ criteria specifically, you could see that Breed Middle School was lying in a block group that had both elevated or higher percent minority individuals living there, as well as lower income compared to the state. So not just one, but two criteria from the EJ perspective. So this is useful for identifying potential trends and for looking into additional information and acquiring information for any particular project of interest. So one last feature on the query is that you can additionally look at data in a table or tabular form, in a chart form, and you can export that data to a CSV, which is essentially an Excel table. So if you're familiar with how to use those things, you can access that data, and it will put all those schools and all those prevalences into one place that you can then use for your own reporting. So with that, I'm going to navigate back to our presentation and discuss real-world applications of the data that I've just displayed. So I just wanted to highlight a couple of examples here of real-world applications from a general perspective. And then I will actually show you some specific examples of how environmental public health tracking data has been applied. So in one example, you might need to justify funding. So when we talked about grant applications, there might be a need for an intervention. You can use baseline data to help justify that grant application. So in this case, Breed Middle School has elevated asthma rates. We want to improve the indoor air quality, or we want to look at some other school-based interventions aimed at reducing pediatric asthma. You can look at the data to inform advocacy and the evaluation of potential impacts. So using baseline data and demographic indicators for vulnerable groups to inform health impact assessment might be one interesting option in this kind of general category. You can also inform policy, programming, and budget decisions. So collecting these indicators over time and incorporating them into a community health needs assessment to decide which outcomes should we target. What is our area of interest? So there's a lot of different ways you can approach these data and use them for your work. So EPHT has had a number of what we like to call success stories, where our data has actually been used in a real-world scenario that has helped a particular community or project. So in a health impact assessment, which if you aren't aware, is a way of collecting information about how a proposed project might impact the health of a particular community. This was actually utilized. We utilized health data on the Environmental Public Health Tracking Network to inform one of the first HIAs completed by the Department of Transportation through what we call the Healthy Transportation Compact. So McGrath Highway is a highway in Somerville that needs to be basically grounded. It's elevated and it needs to go down to the ground. So they need to understand what's the best way that we can do that that will have the least impact on the individuals living in this group, in this area. So what they found with tracking data on cancer, pediatric asthma, hospitalizations, and heart disease is that there was justification with elevated levels that there really should alternative projects that should be considered that would minimize health impact. So the consideration of health and inclusion of the public's voice directly led to these proposals where community design considerations reduced exposure to air pollution, The planting of trees is one example, making those intersections walkable, reducing noise, and promoting opportunities for physical activity, rather than just putting the highway directly on the ground and potentially making it even a hazardous situation for the communities that live below it and around it. Success story 2 is the example of an asphalt plant in Norwood. So you can Google the YouTube story. The CDC put together a really nice film describing this narrative. But essentially, there was a long-standing permit for an asphalt plant in the middle of a residential area in Norwood. And they decided after about many, many years to reopen that asphalt plant. But in the meantime, residential areas had grown denser around the plant, and there were citizens concerned about reopening it now that there were many other people living around it. So they weren't able to just stop production because they had this long-standing permit, but EPH data did inform the project planning, and they showed elevated disease rates, which helped arrive at a town policy that adjusted trucking rates and hours of operation to minimize the impact that plant would have on the surrounding community. So those are just 2 examples of how EPHD data has been applied in the past, and we'll leave you with one last slide, essentially. We are transferring to a mobile-friendly website, which will hopefully make the usability much easier. We are going to employ data modules like the ones that you saw on asthma, but specifically for many different determinants of health, so including things from the ACS and ways of combining that data that inform projects. We're going to be working on informing community health needs assessment and potentially data sets outside of traditional environmental health disease outcomes and emergency preparedness. We're also working on exposure content, so to help the public understand how exposure impacts them. And new data sets are on the way, including indoor air quality inspections in public buildings and lead inspections, so that you can understand what kinds of actions have been taken or what kinds of evaluations have been done in your community. We want your feedback, so if you do get a chance to go on your own and navigate this website, there is always this orange button on the left-hand side that you can click at any time and fill out a survey. We will, if you include your contact information, we'll respond to you within 24 hours. And we really do take your feedback to heart because we want to make sure that this website is usable and helpful for everyone that is interested in accessing this data. If you have any questions at all, I know it's a lot to cover, and there's many, many queries that I didn't go into. You can always contact me directly at glennon.berezin@state.ma.us or call 617-624-5757. I look forward to hearing from you, and thanks for listening.